Hola everyone, this is Patty. I'm the director of the Spanish and Medicine program in Latin America. I'm here today to talk to you about our program and tell you how we can help you achieve some of those goals that you have today as a pre-health or pre-med student and preparing yourself to go into a career in healthcare. So I'd like to go and dive straight in and talk to you a little bit about why. Why do you think it is important to speak Spanish? Why is there such a large need for Spanish-speaking healthcare workers in the U.S. today? Well, first of all, let's start by saying that Spanish is the second most spoken language in the world. And in the U.S. alone, 41 million people are native Spanish speakers. Now, that's data according to census, and that's 13% of the population. That is a lot of people. So that makes the fact that there are such a big Latino community in the United States, it becomes a little bit of an issue when it comes to communication. If we think about it, when you are in a healthcare crisis or you're talking about your health, it's one of the times when we become most vulnerable. We're scared, we don't know what's going on. Most people are not in healthcare, so we are on the side of the patient, and it's a scary situation to be in when you don't know what is going on, or when you're not able to let the healthcare worker know exactly what your symptoms are, what your fears are, where you're coming from in terms of your healthcare situation. So imagine and put yourself in that person's shoes. And when a healthcare worker is able to directly communicate with a patient, it just simplifies so much. It makes people become more comfortable, at ease, and they also feel that they are being understood and listened to. So imagine when you are in a situation where you require a doctor or any kind of healthcare professional to be there for you, you're already a little bit vulnerable. And even when you're speaking your native tongue, your own language, you're scared. And sometimes you miss things and you forget to say some things. And imagine having to go through that in a language that you can't dominate for so many reasons. Now at Estella, we worked on a booklet that is called What About Maria? And it illustrates the life of Maria, a woman who arrives to the U.S. From a Latin American country to find a better life for herself and for her children. She and her husband begin to work, but unfortunately her husband passes away suddenly and she's left to fend for herself and her 3 children. So she has to take on 2 or 3 jobs and make the best of that. And, she wants to learn English. She wants to become a part of the community. She tries to go to night school, but unfortunately, she's either tired or she's just not understanding as much as she would like to, and so she feels that she fails at it so many times. And so time goes on, and she is now, into her years and close to becoming a senior and almost at retirement age. And she still hasn't been able to dominate the language as, much as she would like to have. But now she's becoming ill. She doesn't want to be a burden on her children, having them give up their time to take her to the doctor, so she decides to keep all of those things to herself. So she suffers in silence, and at the end of the day, this is what happens to a lot of people who are not able to communicate. They're either embarrassed. It's not that they don't want to learn, it's that sometimes and many times the circumstances are not favorable to being able to learn the language. And this is not to mention the things that get lost in translation as well. There are some applications that doctors will use, and there's also interpreters, and there's several things that they can use to try to communicate with their patients. However, they're not always ideal. The problem, for example, with some of the applications is that there's always a disconnect. It's not always precise, and medical interpreters are wonderful. We aren't always available, and many times the people that are available aren't always the people that are specialized in healthcare. There is a difference as well. One of the most important things, and I'm sure that you'll all agree with me, is having that bond with your patient, is having that trust that you build with your patient, which is top of the line. And what ends up happening is that the patient will create that bond with the interpreter rather than with the healthcare professional. So that's a little bit difficult to get rid of as well in that translation bit or interpretation, if you wish. Every doctor has only a few minutes to spend with each patient. And finding a translator or a telephone interpreter or even using an app is just going to take up more and more of that time. So, we have to think about the future. The numbers that I've been giving you are growing on a daily basis, and so this is going to just increase in the future. We as a program think that we're here to bridge the gap, and we want our students to be those who really have a true understanding of what the situation is and want to be a part of the solution and a part of that bridging the gap for these people, and understanding that it's not a matter of not wanting to speak in English. It's a matter of having the opportunities and the time and the skills to be able to. So we've talked a lot about how important it is to be able to communicate with your future patients in Spanish. And now I also want to go back a little bit and talk about your goals as a pre-med or pre-health student right now. And one of those goals I know is working and preparing your MCATs and your med school applications. So I know that you don't only have to keep up your marks and prepare a great MCAT, but you also have to worry about that application. And in that application, there is an area that sometimes is a little bit overlooked, and that is the extracurriculars. Now, what are some of the admissions committees looking for? They're looking for people to show some clinical exposure, and that means that you've volunteered in a hospital or a clinic or a seniors residence, or anything that can tell them that you have been exposed to what it's like in the clinical area, in the healthcare area. They also want to know that you have been able to hopefully be a part of a research project, and hopefully that project ends in some kind of a publication. They want to know that you've been able to do this specifically outside of the classroom, so that's really important to them as well. Volunteering and community service is another area of interest, but make sure that you understand that volunteering in a hospital or a clinic isn't going to check off two of these boxes. When I say volunteering and community service, they want to know that you are someone who's doing something because they want to give back. They're doing this without thinking that you're going to get something back out of it for yourself. It's altruistic in nature, and that's really important. Okay, so make sure that when you're checking off these boxes, clinical exposure and volunteering aren't exactly the same thing. And the same thing goes for shadowing. When you do clinical shadowing, it is not the same as clinical exposure. Medical shadowing is going to let the committee member know that you are passionate about becoming a healthcare professional, a doctor, that you're committed to the profession, that you have seen the good and the bad, the pretty and the ugly, and that you really are interested in becoming a healthcare professional. So that's another part of it, and make sure that you understand that when you are listing these things, they're completely separate and different. Don't forget also about diversity. They're looking for examples of how you are aware and sensitive to diversity, and hopefully you've been able to have some exposure with diversity. Hobbies are interesting as well for committee members, so do list your hobbies. They don't necessarily have to be related to healthcare, but they do have to show a little bit about your commitment, your constants, and the abilities that you have that may translate at some point to a good healthcare professional. And of course, leadership experience. That is also a big one. So don't forget that our program will probably assist you in a lot of those areas. We don't have a lot of time today, so in a nutshell, I wanted to tell you that our program includes, of course, first and foremost, Spanish instruction. We want to get you fluent. We want to help you bridge the gap. We want you to be able to write on your application, whether it's to med school or even to a job, fluent in Spanish, because in today's world, in today's market, that is definitely going to give you an upper hand wherever you're going. This program also includes medical shadowing, which is, of course, for so many reasons, a wonderful experience for you to understand if you are prepared, if this is for you, if this is what you want in your career, not only for your application, but truly for your life. Our program also includes a volunteer opportunity as well as opportunities to participate in research projects. So there's a lot to cover, and I know that we're short of time today, but if you feel that this program is interesting, if you feel that any of the information I've provided for you today is something that you'd like to learn more about, please visit our website at www.spanishandmedicine.com. You can sign up for a free call from one of our advisors, and they will be happy to provide you with more information on our program, and hopefully guide you a little bit through some of those questions that you may have. And hopefully we will be able to provide you with the opportunities you require and the information that you need. So you can write to us, and we can also invite you to some of our open houses that will give you even more information and help you make a great decision for your future. So it was great meeting you all. Un abrazo, that means a big hug from Latin America, and we hope to see you down here real soon. Take care now. Bye-bye.